how an MRI machine works?
And that magnetic field actually interacts with magnetic field which is produced by our own hydrogen.
It's like a two-way walkie-talkie then?
The machine communicates with us, gives us energy. MRI you can do every day, all day long.
So it's just trying to escape and this is keeping it in place.
A couple of times leggings caught fire right on patient.
Can you explain to me in quick terms how an MRI machine works?
MRI machine, what you see, that big machine produces magnetic field. And that magnetic field actually interacts with magnetic field which is produced by our own hydrogen. Hydrogens, atoms of hydrogens. And when that big magnetic field interacts with our magnetic field, so then that when we receive the radio frequency from the scanner, and specific coils, and then after it's turned off, we re-emit that acquired energy. Almost like I will tell you the story, and then I ask you, paraphrase it. And when you paraphrasing it to me, I record it and see how much you know. This is almost, kind of like analogy how MRI machine works. That the large magnet scanner, we call it scanner, produces magnetic field which interacts with human magnetic field, and then that signal which we re-emit, mathematical process which called Fourier transformation. So we have a signal which is decoded and we have an image.
Would it be fair to say it's like a two-way walkie-talkie then? We communicate to the machine and they communicate back on a magnetic level?
You know what? The machine communicates with us, gives us energy. We accept that energy. And then when we emit, the computer records everything. And by the way, how we re-emit that acquired energy, the image can be composed. So doctor can diagnose, if everything is right or something is wrong with that particular body part which is scanned.
That's amazing. How would you compare and contrast an MRI machine with other imaging solutions like a CAT scan, X-ray, things like that? Why would you get an MRI over those?
For example, MRI shows excellent contrast between tissues. And MRI method is long and it's expensive. However, CT like X-ray, they have use for ionizing radiation. MRI does not. MRI you can do every day, all day long. So there is no contraindication unless the patient has some metal inside the body, some implants or like injury or some, for example, if people work with metal and it can be embodied in like orbits. So there are some specific contraindications for the MRI.
So MRI and CAT scan have similar purposes, but the use case is whether the person has metal or whether they've had sort of a traumatic experience and they need something done quickly. Is that how it's decided between the two?
It depends on what the referring doctors want to see. If referring doctor wants to see, let's say, a tumor, of course, MRI would be better.
When I look up MRI scanning centers, they always say something like 1.53 T maybe. What is that?
It's a strength of magnetic field. Like sound is measured in decibels, distance is measured in miles, magnetic field strength is measured in Tesla. Let me tell you, the Earth's magnetic field, which creates gravity, it's measured in Gauss. It's 0.05 Gauss magnetic field. 1 Tesla means 10,000 Gauss. Can you imagine how that machine is stronger than magnetic field of Earth?
So an MRI machine is 10,000 stronger than the magnetic pole of
1
the Earth.
Tesla. 1 Tesla.
So it's actually more. So it's 15,000 for
For
one and a half.
example, yes, 15,000. If we have
It'd be
3 Tesla,
30,000
30,000, yes. However, we have 7 Tesla, 14 Tesla. We used to use those machines for research only.
Why would you do a 1.5 versus a 3? So the pole's stronger, but what does that mean?
The stronger magnetic field creates the higher quality pictures, more details it has greater signal, means like intensity of the image and higher resolution. However, the stronger magnetic field, the more electricity is used to create that magnetic field. And magnetic field is created when we apply and maintain electricity in the loop of conductor. So, and the electricity escape is a mean of heat.
So to keep the MRI system cool and to protect the patient, how does that work?
When you see that scanner, actually it has multiple layers inside. The first, we have that cylinder with loops of wire.
Okay.
That cylinder creates magnetic field. Then we have additional layer, gradient coils. Then we have shield, magnetic shimming coils. So shimming coils, they keep magnetic field, contained in one position, because magnetic field is in 3D, it can flow away.
So it's just trying to escape, and this is keeping it in
Absolutely,
place.
it keeps it. When I taught MRI students, I always said, imagine you have a flock of sheep and shepherd dogs. Those shepherd dogs, they're shimming coils. They keep those, like sheep together.
Keep them in place.
Exactly.
Where does the cryogenic part?
Cryogenic bed, like cooling system, and liquid nitrogen and or helium circulating in that system, cooling down the magnet. Number one, it reduces heat. Number two, when those conductors, when they cool down, they have almost like zero resistance and less electricity escapes. The higher magnetic field is produced. So the higher magnetic field, the better image.
Better image, but more heat. So the more you need that cryogenic layer to protect the patient.
Absolutely.
And the machine.
Yes, and patient and the machine.
Amazing. Can you explain the differences between closed, open, and standing MRIs? What are the purposes? What are the differences?
It's just configuration. Open MRI, it used to be low field because those machines were built on ferromagnetic magnetized material, and the magnetic field was constant. You cannot turn it off, it's always present. And their machines were very bulky. Right now they're almost obsolete because low field, the magnetic field was lower. It was almost impossible to build up higher magnetic field on those machines. And there were like magnetic field orientation was since negative and positive poles of the magnet. So magnetic field direction was vertical. When you have high magnetic field, and it's built based on cylinder, right? So magnetic field is horizontal. So anyway, right now we have a lot of high field scanners, and they're open because the donut used to be long, now it's shorter, which creates more capacity for larger patients and reduce claustrophobia, because claustrophobia is I would say number 2 reason why a scan cannot be performed, because you cannot force the patient stay still. When patient move, it creates a lot of motion artifact, and it's like, for example, when I take your picture and you move, everything would be smeared.
So it's like how my child's energy will cause all those blurry pictures.
Absolutely.
And it looks like he's the Flash. I've had family members that have gone to MRI scans. One day I probably will need one. What can I expect as a potential patient going in for MRI scan? Like, what can I expect during that session?
Number one, you will be expected, the MRI professional explains the procedure for you. You will read, absolutely. You need to learn what MRI is before you enter MRI facility, because sometimes I scan during my weekend time or evening shift. Sometimes I scan, and what I saw, patient walked in, and when they saw that scanner, they're like, oh gosh, no, I cannot do it. So it's waste of their time, it's waste of our time, because time slot is taken, the patient is not scanned, so it's not good. So what to expect? To expect stay still without motion 15-20 minutes. Expect having no metal, knowing your body. Because sometimes when I ask patient, did you have any surgery? Do you have any pacemakers? What is that? Okay, did you have any surgery? Yes. What was it? I don't know. The surgeon just did open heart surgery. I don't know. You cannot take that patient and put him or her on the table and you postpone that patient, you start doing your research, call the referring physician, ask the history. So you need to know what kind of, if you had any surgery, what kind of surgery, what was inserted in your body, if you have any metal or implants. So you need to have that specific card which explains, is it MRI safe or MRI not safe? Okay. Also, what to expect? Expect loud noise. The higher magnetic field, the louder noise. Actually, that noise is produced by
The
gradient.
3T is louder than the 1.5.
Absolutely, because let's say 3 Tesla, they have higher, stronger gradients. Gradients is additional magnetic field, which changes main magnetic field. So to get image, so this is for MRI students or professional. So the higher magnetic field, the louder noise.
I would say most patients get nervous when they're just going to the doctor in general, but you made a great point. You go in, you see this monstrosity of a machine, you start to second guess yourself. How do we make these guys at home feel a little more calm about it? What can we do to put them at ease in terms of understanding the main
Great
things?
question. When I was MRI technologist, and then when I was working as MRI program director, I was training my students, and I put huge attention to patient care. You want to scan patient, you need to have like 3 pillars. You need to know cross-sectional anatomy. You have to possess outstanding skills of patient care. By the way, how you behave, how you speak with that person. This is your professionalism. You need to establish good rapport with that patient. You need to make him feel that you play in his field. You are here for him or for her. So they trust you. Even though they're so scared, they make it through. They need to know what MRI is. MRI basics physics, MRI patient care, like I said, pathology.
So when I look up on YouTube some videos of MRI machines, so sometimes we make certain sounds and then it changes to another sound, and sometimes it almost sounds musical, but what are those sounds representing? Why are the different
It
sounds?
is. For me, as a MRI professional, it sounds like, it's an orchestra, because different sounds represent different, the program which is applied to your body to receive this signal back. And that noise is produced by gradient coils.
So the louder the sound that the machine makes or the higher the pitch in general means that the magnet is producing more pulse energy?
It's not magnet. It's when you hear that noise. So we have 3 pairs of gradient coils, and they're located on left and right side, top and bottom, and anteriorly and posteriorly, front and back, exactly. And they turn in particular sequence, like left and right, front and back, top and bottom, and their duration is different. That's how they sound. When you hear that, when noise is changed, it means which coil is turned on. This question would be more for application specialist and MRI physicist.
So the coil pairs are actually in a way triangulating on the patient from these different angles?
The gradient coils, they produce gradient magnetic field. We do not use just one magnetic field to scan the patient. Actually, main magnetic field is produced by that large machine. It's static. It never changes. It's always present, always there. And it's always homogeneous or like uniform. The additional magnetic fields, which are produced by gradient coils, they exist only during the time the gradient turn on and then turn off. So those additional gradient magnetic field changes main magnetic field to alternate the way how our nuclear of hydrogen react.
Wow.
That's why to become a MRI technologist, it takes at least 18 months to understand how everything works. So many little details and put it together.
What can an MRI patient expect with their scan in terms of time, in terms of
They're supposed to be very still. They should expect it's cold in MRI facility and expect loud noise. However, in MRI, we use a noise shield system like headsets with music. We comfort patient with a warm blanket and outstanding patient care.
got it? So some ways patients could prepare comfortable clothes, baggy clothes. Is it good to have long sleeves, long pants to keep
You know what?
warm?
Later practices shows that we undress and make patients change anyway. Because sometimes, female patients, they were like leggings and unfamous situation when couple of times leggings caught fire right on patient. Yes, because that thread, what makes elastic the pants and stretchy, they had like very small, I would say microscopic metal thread.
So when most people think about the dangers of MRI machines, they think about the metal, obviously, because it's a magnet.
Hmm.
But there are some materials, fabrics, for example, that maybe because of the heat that's being produced, it actually has the potential to catch fire.
Yes,
So are there certain fabrics to avoid, like with clothes? So you mentioned leggings.
that's why we have gowns in the MRI facility and we ask patient to change.
Okay, so the process is you come in, doesn't matter what you're wearing, you get a universal gown, you get a headset, maybe it has music, you get covered in a blanket to keep you warm from the cold of the
Not
cryogenic.
too comfortable, because if patient feels too comfortable, they fall asleep and start twitching. So comfortable, but at some point,
Got it.
not too much.
Comfortable enough.
Hmm.
Well, thank you so much. That was
You're welcome.
amazing.